Investors predicted that Donald Trump would be less likely to crack down on outrageous drug prices than his opponent, Hillary Clinton. Along the campaign trail, Clinton was very vocal, speaking out against price gouging. But after her loss, shares of biotech ETF spiked 9%. In a surprise move, Trump told Time magazine that he planned to bring drug prices down, setting off a frenzy on Wall Street. His comments published this week, just the latest swipe at American industries he's cracking down on. For more on the cost of medications, we're joined by physician and licensed health insurance agent Kevin Wacasey. Thanks for joining us.
Thanks for having me.
Dr. Wacasey, you describe yourself as a whistleblower on America's broken health insurance system. Is the president-elect a good thing for drug prices and the overall health insurance?
Well, I think so. One of the big problems that we have in this country is a lack of competition, a lack of free market competition, especially in the pharmaceutical industry. Now, that being said, there are some really outrageously and overpriced drugs out there. Take, for example, the EpiPen is a controversy that erupted this summer over this price spike increase in the price of the EpiPen. And the reasoning behind that, I wrote a book. I call it Dr. Wacasey's Guide to Buying Health Insurance and Healthcare. And in my book, I write about this EpiPen controversy and the reasons behind it and how the media seems to get it wrong sometimes about what's really going on behind the scenes. And basically, the EpiPen controversy erupted because of the pricing, which is due to a lack of free market competition. Let me explain what I mean by that. The FDA has blocked and or stalled the entry of competitors to the EpiPen into the marketplace. Now, I'm not sure the reasoning behind that, but what I do know is that creates a block to competition, which means that if you're the only game in town, which the EpiPen manufacturer seems to be these days, you can pretty much charge whatever you want to for that medication. There's other things that they've done by making deals with health insurance companies, et cetera. But when the FDA and when political bodies step in and create laws and regulations and block competitors from entering the marketplace, it does nothing but keep these prices artificially elevated. So I'd like to see President-elect Trump, he made the argument that he plans to repeal and replace Obamacare, and I wrote a post on my blog at HEALTHCAREONOMICS.com called Hold On, Mr. President-elect, where I appeal to the President-elect, Mr. Trump, not to replace much. He needs to keep repealing things. And one of the things that he could repeal, or at least bolster, would be to have the FDA allow free market competition, allow the easier entry, if you will, of competitive drugs into the marketplace. That's the only way he's going to get these prices down, is by increasing competition. And he knows that. He's a businessman, so I think he knows how to do that.
Okay, so you explained how we could possibly get the price for drugs down, and that's provide more competition. What about healthcare in general?
Well, healthcare is extremely overpriced. Again, I cover this in my book, and the big reason that it's overpriced, if you will, I wrote a chapter called The Usual Suspects, and I talk about how the media, you guys accepted, tends to blame a list of usual suspects for why healthcare is so costly, which it's really not costly. It's just overpriced. It's chargely, if you will. It's overcharged. $12 for an aspirin tablet is not a real representation of what that aspirin really costs. And so when you get into this, you think about the usual suspects we hear about all the time: the elderly, the sick, the uninsured, malpractice premiums, technology, and big pharma, of course. My rationale is that all of these suspects may have been present at the scene of the crime, but none of them actually pulled the trigger and caused the $12 aspirin prices we have today. What actually did that was when health insurance took over the pricing, or took over the payment of health care 40 years ago in the managed care era. And what that's done is created a system where the consumer of the healthcare services, the actual patients, have no input. They don't have any care about the pricing, or they didn't, I should say. Let me correct myself. Because health insurance for the past 40 years has acted as a third-party payer system. In other words, you pay your health insurance company, and then they covered all your healthcare costs. Well, I'm here to break it to your viewers. Those days are over, and they're probably not ever going to come back, because what health insurance has done now, it's transitioned into a true insurance product. And what that means is that if you have a $1,000 or a $3,000 or a $5,000 or a $10,000 deductible on your health insurance plan, you're a consumer. And so what that means for the consumer is that people and patients really need to get into the pricing of healthcare instead of just walking into a doctor's office or walking out of the MRI facility and leaving it up to someone else to determine what they're ultimately going to pay. Because folks still believe that it's all about a copay. I run a cash-only clinic in the Dallas-Fort Worth area where I don't accept any health insurance. And I train my patients on how to take advantage of that. And I do it in the book as well. I teach people how to take advantage of everything from saving money on ambulances to operations. It can be done. It should be done. It's just that people really aren't doing it. And I think that that's the big reason why we have these high charges within healthcare. It's not the costs, it's the charges again. And once people start realizing that, I wrote a line in the book towards the end that the health insurance industries and healthcare industries are never going to change their behavior until the patients start changing their behavior by the millions. Once that happens, we're going to get a big reset. And in fact, this healthcare bubble is going to burst, and I suspect it's going to be a big one.
Okay, so it's on the patient to do their research and make those decisions. So it sounds like you and Donald Trump both have something in common, and that's blaming the media for things. So do you agree with Trump, though, with this pick Dr. Tom Price as the Secretary of Health and Human Services? Is that something that you also agree with him on?
Dr. Price is a physician by training and has been in the Congress for a long time. So I think that he is a good pick. I think if anyone understands what's going on, the problems within healthcare, he probably does. But, you know, my experience is, and forgive me for blaming the media, it's really everyone's been trained wrong. Everyone's been taught wrong, and the blame for that lies mostly with the health insurance industry. They've had a stake in the game to keep everyone confused for as long as they could. But really, they've given us the opportunity now to clear up all this confusion with these high deductibles. In other words, if I have $1,000 or $2,000 or $3,000 to spend of my own money, it behooves me to get used to that, to start demanding pricing. And I think that this is something that Dr. Price, the incoming HHS secretary, he may not even be aware of that. He may not even be aware that this is the fix. To me, this is the cure for what ails our healthcare system, is just people getting on board. And the nice thing about that is it's free, it won't cost anything, doesn't require much legislation except for us to repeal other laws. For instance, the Health Maintenance Organization Act, that would be a great one to get rid of. Let's get rid of networks. I find it interesting that none of your viewers would tolerate being told where they could or couldn't go for pizza tonight. And yet they will tolerate a health insurance company telling them you can't see that doctor anymore. Well, my premise is you can see that doctor if you choose to. It's just that you're going to pay for it now. And you should be paying for it because your health insurance most likely doesn't cover it. And if you do choose to pay for it, most likely you can get a much better deal than the price that the health insurance and the healthcare provider have already negotiated for you.
And it's just a matter of figuring that out with your healthcare provider and doing your research. Dr. Price has said unleashing the power of choice and competition is the best way to lower healthcare costs and improve quality care. We'll see if that's the direction our nation is headed in just a few short weeks. Dr. Kevin Wacasey, thank you for sharing your insight.
Thank you. I appreciate it.